Hi, and welcome to this video presentation on how to settle a crying baby. My name is Emily and I'm a child healthcare student nurse at Flinders University and living in WA up in Broome at the moment. Now I've broken my foot, so today's presentation will be seated down. So without further ado, we'll be discussing why babies cry, how to settle a crying baby using safe techniques, why they don't always settle, red flags to look for when they're crying, and when you need to come and get help and support for yourself. Now, we can all appreciate this can be an extremely stressful time in a parent's life, navigating why their baby's crying and what they can do to help. It's pushing them to the point of exhaustion. So, just so you know there is support out there and you're not alone during this. So we'll discuss all those options for you. So why do babies cry? It's how they communicate, basically. In the first 3 years of life, babies need constant nurturing care to feel safe. The crying, it helps form close relationships with the caregiver, especially in the first 3 months of life. The pitch and the intensity of the cry varies with babies and different things what they need, and that's designed really to give the caregiver a sense of urgency that baby needs something and I need something now. As babies do grow older though, that's when it's easier to judge maybe what they need. A lot of parents find it a lot easier to, that's a hungry cry, that's a tired cry, and as well as, their emotions in their face and, rubbing of eyes and all that. So that makes it a bit easier as they get older. When babies cry excessively, that's what we tend to call infantile colic. We'll discuss that in the next slide. Infantile colic is basically defined as excessive crying with no known cause in an otherwise healthy, well infant. It's not uncommon. About 1 in 5 babies have this, and it's basically when they're crying about 3 hours a day for more than 3 days of the week. Usually the crying intensity and duration picks up at night, is usually when parents find it, and that they're not hungry, they're not overtired, soothing techniques aren't working, and parents become a bit into despair. That all you can do is try, and there's not always a cause for their crying. This does usually resolve within 3 to 4 months of life, sometimes up to 6. It can be very challenging for parents. So we'll move on to other common reasons for crying and some techniques to help. So aside from infantile colic, where there's excessive crying, common reasons for crying are the things that babies need. They're trying to communicate, they feel uncomfortable, they might feel hot, they might feel cold, they might have a wet or soiled nappy and they're feeling a bit uncomfortable with that. They might even just be in a position where they're like can't move, feel uncomfortable, feel a bit distressed, because babies can't do anything really themselves. They're requiring you to help them with everything. So that's their way of communicating with you. They could be hungry, they could be tired, they could be in pain. They might just need a bit of reassurance that you're still there, and they're trying to say, I need that connection with my caregiver. I need that, close attachment. I need that, sense of security. Or they might not feel well. They might have a gassy tummy. They might, have pain somewhere, feel a bit sick, need to burp. There's lots of reasons that are common and normal for babies to be crying about, and it's just about working through that process to kind of, what does my baby need? What can I do to help? What are they trying to tell me? And sometimes we just don't know, but that's when you might need to get a bit of support or look at some red flags to look out for if you really can't work out why your baby's crying. So these are a few techniques on how to settle your crying baby. So this is my baby. She's got a full head of hair, but let's just pretend she's a couple months old. So you know, your baby's in the cot or lying in the pram, simple things like picking up your baby and holding them, you know, it just gives them that sense of reassurance sometimes. A bit of rocking, swaying, sometimes some shushing, shh, 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 a bit of singing, sometimes a bit of a pat on the bottom can really soothe the baby. If your baby's still very young, skin to skin contact's great. That sense of warmth that they're close to their caregiver really can help sometimes. Changing the nappy. If they've got a wet or soiled nappy, it's not comfortable. So simple things like that, warming them up, cooling them down. They can't regulate their temperature like we can, and they don't have the ability to take off a layer of clothes or you know, put a blanket on. So just being attuned to how your baby might be feeling their head, feeling under their arms, if they feel quite hot or sweaty, or if they feel quite cool, it's important to warm them up. You know, temperature can sometimes be good for that as well, seeing if they've got a fever or what their temperature is. Swaddling we'll touch on the next slide. And movement, walking with a pram can sometimes be good. Back to forth movement. Sometimes babies love being in the car, sometimes that helps. Changing the environment, so sometimes babies like a calm, darker room, other babies like you know, some sounds and some white noise and stuff's happening, and that might give them reassurance that someone's there. A feed is always good, you know, some breastfed, or if they're formula fed, or offering a dummy or pacifier if you're using one. And finally, babies can sense a room. So if there's lots of anger, or if someone's stressed or crying, or, you know, babies are actually more attuned to what's going on around them, so just be a bit mindful of that. So some safe swaddling techniques. Traditionally, babies were swaddled quite tight. They were, you know, quite restricted. And research has kind of shown that this has been proven to cause developmental dysplasia of hips, so some hip problems in babies. So it's really important to not swaddle your baby too tightly around the hips, and to let them have that free range of motion, kind of like froggy legs as you're swaddling them. And it's important to not swaddle your babies for longer than maybe 3 to 6 months old, or basically when they can, if they can roll themselves over, you shouldn't be swaddling them. You shouldn't be swaddling them anymore. So I might just show you just one technique that was from Healthy Hips Australia, where they have safe guidelines there. There's a few other techniques that you can have a look at on their website, but this one's called a diamond technique. So it's just folding over the end of one of the corners there, and then positioning baby where their shoulders align with the top of the swaddle there. You can hold down one of their arms like that, close touch their body, and then wrap the swaddle around like that and tuck it under their side there. Then you can do the same to the other arm, so nice and tight there around their arms. And then you can assess their legs and see that they've still got some froggy legs here, and it's not restrictive around their hips at all. For this technique, you can just do a little loop like that and tuck it under. And then babies, nice and swaddled, sense of security, and should feel quite comfortable in that position. So there's no right or wrong here about when you should seek help. It's basically if you're concerned about baby, or if someone else is, or if you're concerned about yourself and your parenting ability with your baby's crying and stress, then you can seek assistance. There's no right or wrong there. But, you know, obviously if your baby is looking unwell, if they're having diarrhea and vomiting or regurgitation, if they have any weight loss, it's important to seek some medical attention. If they've had a high-pitched, prolonged, extreme cry, you know, there might be something going on that, you know, you need to treat. Like baby might have an infection or trauma, abdominal pain. They could have eye issues, bites. They could have one of those hair tourniquets on their finger. You know, if they look like they're having trouble breathing, or they're pale or blue around the lips or anything like that, it's important to seek urgent care, because there's some red flags. that will need to be addressed. But otherwise, if you're concerned or it's impacting the relationship with your baby, then no one's going to judge you for seeking help. It's really important. Why settling doesn't always work. So we just touched on some times when you need to get assistance and seek medical attention. And if everything's all good and there's no reason found medically why your baby's crying, sometimes crying can just be normal for that baby's age and development. This is referred to as purple crying. So purple crying refers to a time in an infant's development where it's considered completely normal and healthy for babies to cry. This could be up to 5 hours a day. It's usually between the ages of 2 weeks to 3 to 4 months is considered normal. The purple is an acronym, so peak of crying, unexpected crying, so there's no real reason why. They're resisting being soothed, so you tried all those techniques and they're still upset. It looks like the baby's in pain, but there's no pain. It's just what they're doing at the moment, part of the development. It can last 5 hours a day or more, and usually in the evenings. So this is coming towards the end of our presentation, and yes, excessive crying in babies causes parents a significant amount of distress. There's always support out there, so it's normal. It's normal for parents to experience a sense of failure, anxiety, isolation. It might disrupt all your expectations of parenthood. It's not uncommon, okay? So you're not alone. There's supports out there you can reach out to, and it could be a GP, it could be a family child healthcare nurse. There's parenting hotlines depending on what state you're in. This is the one for WA, which is the Gala parenting line. There's Beyond Blue support services for your own mental health. There's pregnancy, birth and baby. There's options, okay? And it's challenging. It can be a struggle for a lot of parents, but sometimes it's part of the normal development of your baby, and other times it's when you need to seek help. So I hope we've touched on a few of those things and a few techniques for soothing your baby, and I wish you all the best.